Hey guys, Eric here again with Move and Power Concierge PT, starting the new year off, Jan 2023, with an interview of a colleague, friend here in Austin, Texas. I've got Kerry Rouse. He's a personal trainer and founder of Rouse Fit here in Austin. So excited to have him here today. Kerry, give us welcome and give us a brief little history about you.
Thanks, Eric. I appreciate that. Yeah, I have been an Austinite for quite some time, been here since '92, but I have been doing personal trainings for the past 20 years, since 2002, and been involved in athletics my entire life. And I've recently founded Rouse Fit, which is a fitness and training and CBD company for health and fitness. And the primary focus is recovery and better sleep for the folks involved. We really focus on our clients and our customers who are 40 plus and are still active athletes or fitness enthusiasts. And so the products we create are specifically for them. And we try to serve them with services for personal training and the products for wellness. So that's a little bit about me.
It's great. I love it. Well, I can, one thing we probably both deal with both our clients, with my physical therapy and then with your training clients and such, is pain. When should we, hit the pause button? When can we work through it? So that's one thing that we kind of wanted to talk about today and such.
Yeah, I'm actually curious to know how you treat that with your clients. So how do you go about choosing which way to do, and what you found is, a lot of times we find that certain specific people that we've dealt with, we learn with every single client we meet. So I'm curious to find out what you've learned.
Yeah, that's great. No, I appreciate that. So yes, pain, when I'm dealing with my patients, they seek me out because they're typically in pain and such. I think the first thing that I have to look at is, how long is this pain sticking around? Is it, for instance, an ankle sprain or something that happened within the last week that's, very painful, swollen, maybe still, hot to the touch. That's one type of pain that we're going to kind of box it in. The other box is that maybe that pain that's been around for 5 months or even 5 years. That's more in the chronic. So when I need to kind of find out where those guys are at, because if it's in box A, which is more of that new injury that's still hot and swollen, we're definitely going to probably hit the pause button on exercise or anything that really aggravates it, so we can encourage the body to let itself heal and such. Vice versa, on that other end, on the chronic end, what we're finding out with, like, we'll say Achilles tendinopathies. These are, injuries that typically can bog a person down for months and such. And what we're finding out, interesting from the research, is that we actually want to load those folks up. We actually want to load that tendon because that helps increase, kind of kickstart the healing process, if you will. So I think that's the big thing first, is when I'm talking with someone, it's like, where are we at here in this injury? Is this new, or is this something that's been around? Because that's really going to help guide me as a physical therapist to know where we start with these folks.
So when you say new, though, I know I'm thinking through, like, what does that mean? Is that a month old? Is it a week old? Is it a day old? What kind of time frame are you thinking of in time?
Yeah, good question. So to get a little geeky on you, so I would call injuries, we've got kind of acute, subacute, and then the chronic. So that acute stage is really going to be from kind of 0 to 72 hours. From there, those folks, let's go back to that sprained ankle example. That's going to be definitely more that what we call R.I.C.E. We're going to rest, we're going to ice it, use compression, and then elevate it. I'm sure you folks have had that. Maybe an anti-inflammatory as well. So really, we're not going to be trying to grind through it, trying to walk with that swollen ankle. We really want to kind of nurture that injury in that first stage. In that subacute stage, that's where we might add a little more activity, some weight bearing and such, if we're still using that ankle sprain example, versus that chronic we're going to definitely, like I said, could use chronic would be something that's been hanging around maybe for 3 months or longer kind of thing. And that's where we're going to actually potentially start activity first and get off, lounging on the couch with an ice pack or something like that.
And I've heard different theories on the role of inflammation, and it can be confusing, I think, because people are like, well, inflammation is important because it's part of the healing process. But at the same time, you always hear about, well, we got to do this to reduce inflammation. So
Yeah.
What are your thoughts on that to maybe help clarify for people when it's good and when it's not?
Yeah, I think you make two good points there. Inflammation is critical for healing. Our body is a master at, kind of kickstarting that healing process from the get-go. I'm going to go back to that ankle injury again, that sprained ankle. That swelling and such and the fluid that's being attracted there is there on purpose to help kind of start breaking down and working on the repair of that injury and such. I think where that can get us in trouble is if that swelling with that ankle injury again is hanging around 3 weeks, 4 weeks, 5 weeks and such. That's going to impair your movement. That's going to impair the muscles from functioning normally. So I want that swelling there up front, but as it starts hanging out for longer and longer, that's when it can become not as useful, maybe more of a detractor from someone getting back to their active lifestyle and such.
So the R.I.C.E method you were talking about is really in the first 72 hours, or is it in the subacute as well?
Yeah, I tend to, good question. I tend to use that ice for that first maybe 72 hours and such. After that, we could switch to, if there's some stiffness there, we could add some heat, or you could actually do a contrast. You go ice and heat, which is going to, when we ice, we're going to contract. And then when we heat things, it's going to open up those blood vessels. So we're going to kind of create almost like this little pump to help kind of get some of the fluid out. I think in that subacute stage, when we're, in that 5 days out to maybe two weeks out, we're going to want to start adding movement too. You don't want to just be doing passive stuff. When I say passive, meaning lounging on the couch with an ice pack or something like that. Mm-hmm. In that subacute stage, that's where we want to do some kind of specific motions and such with an injury, be it, going back to the ankle, be it, walking correctly, getting out and doing some light strengthening exercises and such. That's pretty critical. And that's kind of where, I guess, my bias as a physical therapist is where we can really help folks out to make sure, kind of guide them like, okay, you're here, great. Now we're in this stage. We've got to start moving on. I think that's where physical therapy comes in.
There are 2 points I wanted to bring up. One is during the acute phase, we're still using, elevation, compression, ice, and things like that, and that first 72 hours. Now, those modalities feel like they're things that help reduce inflammation, but inflammation's important, especially during the first 72 hours. So you're not trying to stop the inflammation from happening with those modalities, it's more controlling it maybe, so that when you do get past the 72-hour point, you can begin to do movement, because with too much inflammation it's too difficult.
Yeah, I think you nailed it right there. Also, the ice is going to help with pain as well. So just in the pain, the more and more pain you have, the more and more restriction you might cause yourself, which can kind of cause that swelling to kind of stagnate down in the region of the injury too. So yes, we want that normal inflammatory process to happen, yet we want to maybe control it so it doesn't get maybe out of hand and such.
Got it. Yeah, I noticed and the other thing I was going to mention is I have gone through a rotator cuff surgery before, and I'd never gone through something like that. And any kind of injury I've had it before, it was you feel bad, you worry about hurting it more, and you hold off on your movement, which is probably the wrong thing to do, especially when you're a few days into it. I followed my doctor's advice And we had specific stretches and things like that. And I mean, every day was a painful day. Every single day was a painful day pushing through it. But I had almost full range of motion, maybe 6 weeks after that surgery. So it was a really fast healing process, but that was because of the movement.
Yeah, exactly. So when you're dealing with an injury like the rotator cuff, be it, a surgery is a little different, but, or a strain, if you will, to the rotator cuff, timing's going to be a little different, but definitely movement. Yeah. As you said, the movement, the stretching you did was key to you getting your range of motion back and being able to restore the function of the rotator cuff muscles to make that shoulder, be able to do what you needed to do activity wise, from throwing a ball to picking up a jug of milk.
Yeah. And so let me ask you this. I've had a specific type of injury myself where I have bone on bone in both my knees from just the cartilage wearing out, really. Mm-hmm. And that started at a pretty young age for me, almost like 24 years old. I had a scope on one of my knees. They took out some of the cartilage, which unfortunately just made it worse. So now any type of running or jumping movement, it doesn't take but 30, 40 minutes of that. And my knee starts swelling up and it stays swollen for 5 or 6 days. And at this point, I just decided that I need to do something else besides running and jumping, And so I've picked up cycling, which doesn't interfere, doesn't cause that bone on bone. So for people that are in that situation where that particular movement, it produces an inflammation that is quite painful. It just fills my knee with fluid each time. Mm-hmm. Other than ice, and maybe, we know movement is good, but mm-hmm. I feel like movement in that situation there's no way to avoid aggravating it.
Yeah. Well, I think so. So your example then is kind of with moderate, it sounds like kind of moderate to severe knee arthritis, right? Yeah. So I think you can use that swelling or finding out, in your case, it sounds like if you were to go out and, jog for a half mile or something like that, or a mile or something like that your knee would maybe swell up the next day, definitely like that. I think my first thought for those folks, or my instructions would be, don't give up on it. And we're learning more and more about knee arthritis. I think you got to have a strategy and kind of just, step back and learn about what other exercises you can to kind of build up the shock absorbers of the knee, which are going to be the kind of the bigger muscles of the leg, the thigh muscles, the quads, the calf muscles and such, and build a tolerance to that joint. Start gradingly do it. Now, this is a long process. This is, months versus, like an overnight. But I think if you can find the exercises, like what you're doing the cycling and such, low impact exercises are definitely going to be the kind of a entry point, I think, of trying to kind of condition those leg muscles, and then also strength training too. I'm a big proponent of you've got to start, making sure that the quadriceps, the whole lower chain from the glutes all the way down to the calf muscles, making sure they have the strength to be adequate shock absorbers when you're doing, from walking in the mall or, to, taking your dog for a walk to maybe something a little more high impact and such. So
something I've been doing, and this relates to the movement theme, is low impact, slower movement squats and then full range squats, specifically to try to help my knees by building the muscles that need to be built up, but also forcing my body into a more full movement. Right, I do to the squat all the way to the floor, beyond parallel, and then back up. And I started with body weight, and
Mhm.
I'm just slowly adding more and more weight by holding a dumbbell. And I feel like my legs are getting stronger, and pushing my legs into that extreme extension is actually helping with the range of motion for my knees. So that's one way I'm trying to do it. And I hope that other people hearing this understand that I really still, totally believe that movement is the key to get through some of this stuff, but it's got to be a wise movement. I'm not going out and doing plyometrics on boxes or anything like that.
Sure.
That would be nuts. I couldn't do that.
No, I think, but you started out, I guess, for the listener who might be having problems with knee arthritis and building strength, you probably didn't start with those deep squats from day one. You worked up to that for sure.
Yeah. I mean, for me, I spent hours and hours and hours building up my leg muscles on a bicycle, and that's a totally different movement, but it's still working those muscles.
Love it. Yep. Yeah. Yep. Nailed it. So tell me, from your perspective, you spoke earlier about with CBD products you have.
Mm-hmm.
How are you tell us about, the CBD product? I guess my big question is, there are a lot of products out there. How does the stuff I can get at the grocery store to, I guess, maybe what some of your products, is there a difference,
Yep. So there's a lot of different ways that you can formulate CBD, and CBD is just one cannabinoid, and there are a couple hundred of them. It's just that CBD is the most well-known one. It's the most well-studied. It's the one that's in the highest quantity by far of any cannabinoid that's out there. And we have cannabinoids in a lot of different foods and things that we already eat. It just so happens that, with the marijuana plant is the one that has gotten the most notoriety because it's got such a large amount of cannabinoids in it, with CBD being the highest. And we've probably also heard of THC, which is more of the hallucinogenic one. And so there's different ways to put it together. So there's CBD isolate, which is only the CBD cannabinoid in a certain product. It could be oil, it could be something else. And then the next item that you may hear is called broad spectrum. And what that means is it's CBD plus several other trace amounts of other cannabinoids, except not THC. So it could have all the cannabinoids, but not THC, and that would be broad spectrum. And then full spectrum is just all of them, including THC. Those are the different designations for how the cannabinoids are put together. And then, of course, you can't have more than 0.3% THC in any product, or that would be illegal. And then even any amount of THC, depending on the locality that you're in, could be illegal. But hemp-based CBD at the federal level is legal. And so those products can be CBD isolate, broad spectrum, or full spectrum. So that's one way to understand the differences of what you're getting. There are some theories that having the trace amounts of the other cannabinoids with CBD allows CBD to work better, but there really isn't enough studies yet to prove that. So there's some in place right now, and it's just going to take some time to get the results back from that. But there have been several studies completed for pure CBD and its effect on the immune system, on just general wellness and your ability to sleep and fighting pain. Now, the way that these things work is they don't themselves, CBD itself doesn't make the pain go away. All these cannabinoids work with your endocannabinoid system that's in your body. And that system, when working properly, essentially just allows your body to work in the way it's supposed to work. It allows your body to fight pain in the way that it normally fights pain, or fight improve immunity the way that it normally does. And we find that our bodies are usually deficient in CBD, or there's something off. And that's why recently, with the introduction of CBD supplementation, we're finding that we're allowing that endocannabinoid system to work better, and then we feel better. So the most common one, I think, is really, we hear about pain or just relief that you can get from using CBD products. I myself got introduced to it through lifting, and I like to push when I lift. And I had a tennis elbow type pain for months. It just would not go away. I kept on lifting with it. I kept on moving with it, and was introduced to a CBD cream that I put on my elbow. And there's a little bit of an immediate relief, but after 2 weeks, it was gone. And it was something I could not get rid of for months. I've done the same thing with an arthritis pain I had in my fingers when I was lifting. And you still have to grip when you lift. and I wasn't going to stop lifting. And I kept on re-aggravating it. I started putting the cream on, and within 2 weeks, nothing, no pain. So I've been sold on the stuff for a while. One other aspect you asked, which is really important, that people don't realize, and that is the concentration of the CBD. And it's typically, the units are milligrams of CBD per milliliter of solution that it's in. So if we're talking about a CBD oil or tincture, that would be, there's 1 milliliter in there. So how many CBD milligrams are in that milliliter? And that's usually 100 milliliters in the container. So the thing that you've got to do when you go shopping for these things is do the math, because they won't do it for you in most cases. So take the total amount of CBD milligrams per the bottle divided by the milliliters in the bottle. So a good rule of thumb is 50 milligram per milliliter is a good amount for the creams. That's a good amount for the creams. And then for the oils, you probably should be shooting for 100 milligram per milliliter or greater for the oils. So look at those measures. When I talk to my scientist at my manufacturer, a minimum amount for the creams where they found the most effective results was at 50 milligram per milliliter. There's another common form of CBD that's out there, and they're usually in the form of CBD gummies. And those are generally going to have a lower amount of CBD in them. Those are generally just for sleep or general wellness. And I can tell you that if you put too much CBD in a gummy, it's not going to taste good. So they usually limit those to 25 milligrams or less per CBD gummy. So
there's a lot of, what I'm hearing is it is important to kind of do the math to kind of find out, the amount of the CBD in there. And be it a cream or a gummy and such. That's good stuff. And it's also interesting that, like you said, tinctures, is that like drops then? So there's drops, there's gummies, there's creams. It seems like there's a lot of different ways you can
there's a lot of different ways. The three most common are the creams that you rub, and it's more for localized muscle and joint pain. Like, you're not going to absorb that all throughout your body, but it's definitely going to help the area that you're rubbing on.
Okay.
The CBD oil or tincture is a drop you put underneath your tongue. You hold it there between 1 and 3 minutes, and it absorbs directly into your body and gets CBD into your whole system that way. And then the CBD gummies are just an easy way to take some CBD. Generally, it's usually used for helping people sleep. You take 1 or 2 before you go to bed.
Okay, good to know. I think that's important for our listener to know. This is a lot of this is good information for me because there's a lot out there and I'm like, well, how does this stuff work here? So great to hear. Great to hear. And then how do you, I guess my question is, so you offer your clients, these products, you've shown them, hey, for the aches here, use this and such. How often can you use these creams? Is this a daily use? Is this, a few times a week, or, kind of help us out on that?
Yeah, I would say the cream is, depending on the size of the area, you're only going to need about 1 milliliter of cream to actually resolve the issue, unless it's a large area. But I would apply it, 3 to 4 times a day, depending on the severity of the pain. And definitely before a workout, definitely after the workout, and maybe morning and evening. Something to keep in mind, a lot of these creams have menthol or lidocaine in them. So just make sure you wash your hands afterwards so you don't get anything in your eyes. The oils, it's just 1 milliliter underneath your tongue per day. And the gummies is just 1 or 2 before you go to bed.
Gotcha. Good information. All right.
Yep.
Excellent.